Hello, everybody, and thank you so much for joining me today. So I'm going to start off the way we start off every day at our center. Good morning, good morning, good morning to you. Our day is beginning. There's so much to do. Now, to you, it may be hard to hear, and thank you for still being in your seat after such a horrible rendition. But for our children, it's stability and it's predictability. For children who are always going to the hospital, who are always getting poked and prodded, these children know that that is the rallying call for we're gonna have a normal day. Now, as I look out in the audience, I look at all these wonderful faces, and there's one that's a little intimidating. My 13-year-old daughter, I'm gonna have you stand and say hello, but her birth was what birthed this organization. And she made me promise her one thing, and that I wouldn't embarrass her, and so I'm sorry, honey. So let's get started. In Loving Arms Pediatric Day Health Center, a center for medically fragile children. So as we think about the plight of a mom who has a child that has medical fragilities, we say, what is the center needed for, and how does it benefit our community? The Pediatric Day Health Centers, in 2010, a group of moms petitioned the state of Louisiana saying that our children will always be medically fragile and will always actually either not be able to go to work or go to school. So how can we do like the adult day health centers and do something for the pediatric population? And as a result of that, the state of Louisiana funded these facility centers, and in Loving Arms was the third licensed center and is the largest pediatric day health center in the state of Louisiana. So pediatric day health centers can care for children up to their 21st birthday, and they can provide children for breathing. So who do we serve? Infants and children with complex medical needs. So technology-dependent children, developmentally delayed children, and children with multi-system involvement. And I'm also an adjunct professor, so when I talk with my students, I'm always telling them, you think about the loaf of bread that needs to stay in the oven an hour. Well, the electricity goes out and 30 minutes into it, the bread may be almost done, but think about the child. Cognitively, there's delays. You may have eye damage. You may have lung damage. You may have gastrointestinal damage. So multi-system involved children are who we serve most generally. Patient qualifications or criteria. They have to be medically complex or fragile. They have to be stable in that they don't need immediate hospital care. Doctor has prescribed their entrance into the facility, and they must be appropriate for our outpatient care. We get lots of calls for parents of autistic children. Unless there's a skilled nursing intervention, those unfortunately are not the children that we serve. So we're serving children who have a skilled intervention, who need a nurse. So if there's medication, if there's a G-tube, those are the children that will come into our facility. So we're kind of a hybrid, a different concept in care. So some of the complications of the patients that we actually see every day. We have colostomy care, genetic disorders, orthopedic conditions, feeding disorders, gastroesophageal reflux disorders. We have cancers, failure to thrive, end-stage diseases, so we work with hospice with those children so that moms can go back to work. Post-traumatic injuries such as car accidents. We have G-tubes, NG, GJ tubes, fetal alcohol syndrome. So the complications of children are very far-reaching. Nursing care, what does a nurse at our facility do every day? So daily assessment, medication administration, IV infusions. We do tube feedings every 3 hours. We have daily intervention and management of the child's needs, and ongoing communication, which is the single most important thing that a parent can rely on. How was Johnny today? Were there any health changes? Is he getting any better? Will he be okay? Therapeutic intervention, physical, speech, occupational therapy, and a social services person that works with the family to make sure. We recently had a milk crisis, so having someone work with the different doctor's offices to see what can my child take because this formula is not available. Certified teachers. We have a child that has end-stage renal disorder from birth, but cognitively he's fine. So we want to make sure that when they are ready to transition into a traditional daycare environment, they are cognitively ready for that. We are also a clinical learning site for several schools here in Baton Rouge, so registered nurses, LPNs, medical assistants, certified nursing assistants, early childhood professionals, speech pathology, and audiology professionals are able to utilize the facility as a training site so that they can advance their practice and their knowledge with this very popular, this is very, needy population of children. Daily transportation, so that transportation is not a barrier to care. We pick the children up every day with a nurse on board, and we bring them to the center so that they can enjoy the facility of the center. And when you think about it, home health was originally designed for the suburban mom. The 3 bedrooms, 2 baths, the child had his own room, the caregiver could go in there and provide care. Now we're seeing in the Baton Rouge area particularly, you have the mom, the grandmother, the great-grandmother, 4 or 5 children in a 2-bedroom home. In that environment, you don't really have the facilities to provide the medical supplies and the needing services to that population. So transportation is not a barrier to care with our facilities, and that's actually our bus. So benefits to the child, peer interaction and play. Children learn through play. It builds self-esteem and confidence. We see improved developmental outcomes, and we focus on the abilities and not necessarily the disabilities. Benefits to the family. My child is going to school. Although it's a pediatric day health center, they get on the bus, they come back with their fingerprints and the hand drawings and the daddy, I love you. We have donuts with dads, muffins with moms. So we have Christmas parties and Christmas pictures with Santa. It really normalizes the parent's ability to say, now we're just like everyone else, or similar. How are our services funded? Medicaid, private insurance, and private pay. Medicaid, of course, pays 100%. Many insurance companies, they only pay the deductible, so what they end up paying is similar to what they pay at traditional daycare centers. So it is more cost effective than one-on-one in the home. In loving arms is where the healing begins. I'm Renita Williams-Thomas. Who they got questions? So I'm opening up the floor to questions. I'd like to entertain any questions that you may have today.
Before you started, where were all these kids getting help?
A lot of children were at home doing home health. A lot of children who did not have the facilities to have someone come into the facility, into their home, they were just being cared for by moms. So moms couldn't work, grandmothers helped out. And when my daughter was adopted, we had caregivers, but every time, you have those good old caregivers that grease them down with the lotion and then the leads slip. So whenever she had oxygen, continuous oxygen, and an apnea monitor, I'd get these panic calls that, the monitors are going off and I'm trying to, delegate from home and delegate from taking a little nap and at work, and I was a nurse doing 12-hour shifts. It's just really hard to concentrate on what you're doing because you're so worried about and the guilt of leaving that child home when you really should have that child taking care of yourself.
What ages do you serve and how do you transition, and do you transition to regular school?
Very good question. We care for children at In Loving Arms 0 to 12. So we do prepubertal. Because when children are cognitively delayed, there's some things that, after puberty, they really are not conscious of, but they, touch and see and whatever. So we do prepubertal. But the state of Louisiana, with the funding, we serve up to 21 years of age. So our center only serves children prepubertal up to 12 years old. And we've got a couple that we have up to 14, but we have our cutoff. We don't accept a child after the 12th birthday.
Do you transition them to a school, or what's the next step?
We do. We transition them to traditional schools when they can. Some of them are so cognitively, physically, emotionally delayed until there's really no reason. And but at 12 years old, we do start to work with them. Lots of children that are maybe complications of prematurity may only stay with us for 3 months. They may only stay with us for 6 months. And those children will move on to a traditional daycare center. So we look at them every 90 days to see where they are and how we can begin the transition process. So we always say that we begin the transition upon entrance into the center. Yes, sir.
How many kids do you take care of?
Very good question. We are licensed for 70, and we're the largest licensed pediatric day health center in the state of Louisiana, and there are 24 in the state of Louisiana. But we look at quality versus quantity. So when we're looking at acuity levels of children, we may not take in 70, may only have 40, because as opposed to being a 3-to-1 is the state standard. 3 children to 1 nurse. So if we have children that are multi-system involved, it may be a 2-to-1 or maybe even a 1-to-1. So we look at that. So we're anywhere in terms of census from 45 to 50. We've never exceeded 50 with the 70 licensure. Yes, sir.
How do you recruit and train your staff?
Very good question, and it's even more difficult right now because it is a very specialized niche. We have to we have in-house training. I've been doing this for 10 years, and prior to that, I worked at Our Lady of the Lake Hospital as a pediatric nurse specialist prior to that. So we've got a training program within our facility, but they do have to come with at least 2 years of pediatric experience, whenever they're coming for an application process.
To your right.
Oh, so sorry. Yes.
Ms. Williams, thank you for what you do in caring for this vulnerable population. Are you a nonprofit?
We are a for-profit organization, so it is not nonprofit. Yes, sir.
Have you considered creating a nonprofit arm?
I really have, and I've actually got a name for the nonprofit arm of it. So if we could talk later, I'd love to. But we certainly have a name for it because there's so many of the children that really have no resources. For Christmas, we do one need, one want for each of our children, and we work really closely with the fire departments in Baton Rouge, the sheriff's office, and things like that. And they've been really generous to the children because it's not like a whole lot of stuff and bags of toys that we like to see go out, but we really know that a lot of our children are very needy and they don't have a lot of the supplies. And the need might be just diaper size 6. The need might be just 2 wardrobes because we're washing the same thing and we're sending those things back to mom. So that is a very good suggestion, and I really have already named that organization. Thanks for bringing that out. Yes, ma'am.
Because you're always transitioning students, do you work with East Baton Rouge Parish schools, and how do you coordinate your efforts with EBR or with private schools? What kind of coordination is there?
Very good question. We do work with, like I said, when we bring them into the facility, we start the transition process. So we work with a lot of the the therapists in the schools because we make sure that they coordinate care. We work with the intake coordinators, but in transitioning the children, we work with the private schools, the charter schools, and East Baton Rouge Parish schools on the transition because that's where those children are going. We're asking moms where you think this child will be transitioning to, and we begin the transition process really upon entrance. Those children that are long-termers that we really don't see very much, with them, they're going to be with us for a very long time. We still work with East Baton Rouge Parish schools because they'll send the specific aides or the certified teachers for those developmentally delayed children into our facility, and they'll work with those children there, almost like homeschooling.
So do you ever accept students? I know in East Baton Rouge Parish, South Downs Elementary.
Yes.
has,
That's a great partner of
special
ours.
needs, very, very severe special needs kids. Do you actually take kids from there when they are older?
Over 50 to 75% of our babies transition into that program, so we have a wonderful relationship. During the summers, holidays, special days off, snow days, rain days, the children can come back till their 12th birthday. So if someone transitions out at kindergarten, they can come back into our facility until they're 12 years old. So we work very closely with those schools because if they have children that may not have been a part of our population, they may transition to our program during those breaks, considering we have opportunities and openings. Oh, sorry, thank you.
As a professional with 12 years of nonprofit experience and a grandmother of 2 critical kids that has passed away, I'll be instrumental in assisting you with any endeavors you may have.
Oh, I love that. Thank you so much. I'll certainly take you up on that. Thank you. Yes, ma'am.
Segues into my question. Do you ever engage volunteers for simple things like holding, rocking babies, et cetera?
Absolutely, yes, ma'am. We have a program where we kind of do a screening, and you can come in, and we definitely, because after COVID, it's very limited in what we can do in terms of bringing folks in, because we don't want, because they're so immunocompromised and they're so fragile, we definitely want to make sure that those portions are cleared, and we do extensive, screening in terms of the, we make sure that they have no temperature and whatever, but background check is something that we do, and volunteers are always needed and wanted, so yes, ma'am. Yes. I'll get you next. No, you're next.
Do you have physical therapists, speech therapists, occupational therapists?
Yes, ma'am. We have OT, PT, and ST that we have at the facility. So it's one-stop shopping. When they come to the facility, not only do they have skilled nursing intervention, they've got the educator that works with them, but they also have the therapeutic intervention. Yes, ma'am. I think he was.
Is there some average length of time that when a kid starts with your program as to how long they're there, or is it just a kid-by-kid basis?
It's a kid-by-kid basis, because if you think about it, the ones that maybe have complications of prematurity, once their airways are a whole lot stronger, they're moved on to a traditional daycare center. Then you have some that have a rare genetic syndrome. They're going to be with us really until school age, and probably a little bit beyond that. So it really just depends on what you get and what's going on with them on their length of stay. We can pretty much determine upon their entrance, based on their diagnosis, what the longevity might look like, but it'll all depend on what happens when they get there. Yes, ma'am.
Would you tell us about the services provided to families, and particularly the siblings of your students?
Excellent question. Thank you for that. We have, because the social services will work with them on their needs, and we have like even little support groups, such as if you have a G-tube, or if you have asthma, or if you have seizure disorder. So we do ongoing classes and education and support. Also for the ones that may be really intensive, because these children get so much attention and the other children may often feel left out. And some of the big things are like grandmothers. Grandmothers are bragging with the barrels on the children, but for these children, grandmothers shy away. Some grandmothers shy away. They have too much equipment and too much feeding and oxygen, and it may be too much. And it's almost like some are just embarrassed because they've got to explain again what's wrong with my grandchild. So talking with moms and talking with some of the grandmothers on what to expect and how to handle certain questions are some of the things that we do as well.
Renita, can you tell us about your journey that took you from the lake into the vision that you had to build this beautiful organization?
Okay, what we did was I was working PRN at the lake, at Earl K. Long, and I was working at the Lake Hospital. So putting my child through Episcopal High School, working those extra shifts, and then I come home and this beautiful little girl is born. I'm like, I just knew it was my mission. I said, I've got to do this. And my husband said, well, let me understand. Now you're working PRN to put Kendall through Episcopal, but you've got this little girl that you want to bring home, and we don't even have a puppy. And I said, you know what, when God speaks, it's not a conference call. This is something that I have to do. So literally it was bringing home this child, having, whenever I got ready to go back to work, there was no one who could care for this child. So putting together the pieces and making sure that not only this child, but other children would benefit from a service like this. So that was the process.
Beautiful.
So this one person in the room, I've got to acknowledge him. So Mr. Burkett, Warren Burkett, was the person who helped me write the business plan for this, and I know he's not expecting it, but I've got to tell you, the one time I get in front of this mic, I've got to tell him, thank you so much, because as odd as it sounded to other people, conceptualizing the idea, putting it on paper, long hours, when he would sometimes have to walk away because you know what, you got too much going on, lady, you got to focus. Thank you so much for not giving up and working with me through this process. So he did help me write this business plan. Any other questions? Well,
What are your plans for expansion?
okay. Our plans for expansion, if COVID leaves us alone and monkeypox leaves us alone, is to really spread the mission to other states. There's a moratorium in Louisiana, which means that they're not opening any new sites in Louisiana. But Texas and Mississippi has opened legislation where they are now funding such centers. So we're actually looking at some real estate at this time so that we can move in a different direction, in a new direction, and to expand the service delivery.
I have another question. So if there's a moratorium, is there a waiting list, or you?
It's been there for so long, I'm not sure if they've opened it up and then the funding and whatever. But what I'm just really doing is kind of going where God allows and leading where just following where he's leading. So Texas and Mississippi have open legislation. They've got open money, and they're calling us to kind of see if we are interested in coming into their state. So we're going to move there. And if Louisiana has some more availability at another time, we'll do that as well.
Very good. Thank you so much.